The cornea is supposed to have a round shape, but keratoconus is a disease in which the cornea becomes progressively cone-shaped. When the cornea becomes distorted like this, light can't focus on the back of your eye, blurring your vision over time. In advanced cases, the cornea becomes cloudy. The first signs of keratoconus typically appear in your preteen or teenage years. This disease has a strong association with Down syndrome, affecting up to 1 in every 3 people with Down syndrome. Other risk factors include excessive eye rubbing, chronic allergies and eyelid inflammation, and having a family history of keratoconus. Your pediatric ophthalmologist or optometrist will look for early signs of keratoconus during your eye exam. Keratoconus is a progressive eye disease, meaning once it starts, it will continue to get worse. Glasses and hard contacts might help blurry vision for now, but neither will stop the cornea from continuing to become more and more cone-shaped, eventually leading to vision loss. Early surgical intervention helps to stop the progression, preserving your vision. Corneal collagen cross-linking is a minimally invasive surgery that stops the progression of keratoconus by making the cornea more rigid. Corneal cross-linking is a preventative surgery, so it will not improve vision that is already blurry from keratoconus. The goal of the procedure is to protect your current level of vision by locking the cornea in its current shape, which will prevent future vision loss and prevent more invasive procedures such as a corneal transplant down the road. To start the procedure, younger patients are typically put to sleep under general anesthesia. Older patients may be awake for the procedure. The cornea has layers, and corneal cross-linking works by strengthening some of those layers. Your surgeon begins by placing a ring on the cornea and applying alcohol eye drops to loosen the outermost layer, called the epithelium. The epithelium is wiped away, exposing a thick layer called the stroma, which contains a binding protein called collagen. Vitamin eye drops are applied for about 30 minutes until they have soaked all the way through the stroma. The drops are repeated until your cornea is thick enough for the next step. Next, your surgeon will shine a special UV light on your cornea. This light and the vitamins absorbed from the eye drops perform a chemical reaction that strengthens the collagen bonds in the stroma, making the cornea more rigid, so it will be locked into its current shape and will not continue to become more cone-shaped. Finally, numbing eye drops and a soft contact lens are applied to act as a bandage while your eye heals. For patients with keratoconus in both eyes, the procedure is usually done in 2 separate surgeries. A shield will be placed over your eye before you go home, which should be the same day. You will need to return for multiple visits so your ophthalmologist can check to make sure your eye is healing properly. Once at home, you will need to apply antibiotic and steroid eye drops at least 4 times per day for the first week, then just the steroid drops for the next month. Your eye may feel uncomfortable right after the procedure. Use over-the-counter pain relievers and avoid bright sunlight to feel more comfortable as you recover. Your eye doctor will continue to monitor your vision during your regular vision checkups.